Gifford Provider Podcast. I'm Scott Fleischman, and in this episode, we are speaking with Gifford's breast patient navigator, Jennifer Hubert. Jen, thanks for joining us today and talking about a very serious issue when it comes to Breast Cancer Awareness Month, and that's getting a mammogram.
That is correct.
First, before we get into that, tell us a little bit about yourself, how you decided to get into this line of work.
Well, I've been a radiologic technologist for 20 years, and within about the first 5 years of doing that, I was approached about learning mammography, and it seemed like the next natural fit. So I've been doing mammography now since 2005, and then I became a certified breast care navigator this past spring.
Is there a particular event in your life or just something in general that just guided you into this direction all those years ago when you?
Yeah, I mean, I've always wanted to work in healthcare, but I didn't feel like I wanted to actually be a nurse, but knew I wanted to work directly with patients. So it was actually my sister, actually years ago while she was in the Air Force, just kind of lofted the idea that she worked with radiologic technologists and they all loved their jobs. And, you know, this is now year 20 for me and I do love my job.
This is your second stint at Gifford. So why the decision to come back? What is it about Gifford that brought you back?
I always felt like when I worked at Gifford previously, that it was easy to provide care that I'm proud of and care that I would want my family members to receive.
Again, we're speaking with Jennifer Hubert here, episode 3 of the Gifford Provider Podcast. If you're watching us on YouTube, give this a like and subscribe to our YouTube page. It'll be packed with stories and information that you'll need to know. And if you are listening to us on audio, well, we appreciate that. Leave comments and ratings where you can. Now, before we get into a little bit more of the of Breast Cancer Awareness Month and some of the myths, some of the facts that women should know, talk about Gifford's ability to have the technology to have this done. Such a small hospital, I think people don't realize all of the things that Gifford does provide, this being one.
Right, we do have a fairly new 3D mammography unit. It's pretty standard since about 2016, 2017 to have a 3D mammogram. We have had that here, I believe, since about 2017. It's a wonderful unit. It saves time and gives us so much more information during the mammogram process.
How much of a difference is it going to a 3D than what you had to use before?
There's not much difference for the patient, but for the technologists and the physicians, the amount of information, the amount of images we receive on the mammograms just gives us a much broader picture. It's especially helpful in younger women that have dense breast tissue, as we're able to see through those layers much better.
As your role as breast patient navigator, I think you kind of touched on a little bit with the being the technician part, but tell us about your job specifically.
Well, being a breast care navigator, I work specifically with all of our breast patients, mammogram patients that are facing a cancer diagnosis. Sometimes I work with them from the moment they maybe feel a lump. Sometimes it's that I'm calling them because a radiologist wants them to come in for additional imaging. And once I make that initial connection with them, I follow them through their entire process, whether that means they require a biopsy and eventually get a cancer diagnosis, or whether they just come in and it turns out the lump they felt or what we saw was nothing to be concerned with.
October is Breast Cancer Awareness Month. Do you see, over your 20 years experience, do you see an uptick in patients in mammograms this time of year?
Yes, October's is is often one of our busiest months of the year. Gifford, we do something a little special here. We always give every patient that comes in the month of October a little goodie bag, and they're also always entered in a raffle to win a gift basket. So it really helps that patients, I think, are also aware that we do that, but October is a very busy month for us.
Some of the myths that people or women might have when it comes to going through the process. Maybe there's a certain age that some women say they don't need to get it until that age, or kind of to debunk some of the myths that might be out there.
Okay. Often the guideline for us, we follow the American College of Radiography's guidelines, which is to start having mammograms at age 40. And unfortunately, right now, it's not even necessarily myth. There's just a lot of information out there about when the right time is to start. And unfortunately, that's often a conversation between the patient and provider about what they feel is best for them. Myself and the staff here at Gifford, we truly feel that, every year starting at age 40 is the best.
And what's the process like? Maybe there's some women out there that feel this could be a painful process. They don't want to go through it. Talk about that.
Unfortunately, mammography does have a reputation of being painful or uncomfortable. I would categorize it more as discomfort, because obviously we are compressing the breast tissue between two plastic plates. However, we are highly trained and we try to do it with the least amount of discomfort possible. And it really shouldn't be painful. If it's painful, you should talk to your technologist about repositioning, going slower, just different things that we can do to make the process more comfortable. We use mammo pads here at this facility, which is a foam pink pad that goes over the imaging receptor that helps with some of the discomfort. And not all facilities use those, and we do use them here. They're single use, so every patient gets a brand new one.
Do you have an experience where someone's come in and they were hesitant, and then they did the mammogram and it discovered something that, otherwise would have gone undetected, maybe saved a life?
Often being a breast care navigator, I've certainly had many patients come in with lumps that they have felt. Luckily, majority of the time, the lumps have been nothing, but there have been a few instances where I've had some very young women come in, unfortunately, having felt a lump and unfortunately have been diagnosed with cancer. And luckily, because they got right in and got detected, they're on the path to recovery.
I mean, it's not just mammograms, obviously. Self-checks are so important. Tell us about, the best technique for self-check. How often should women do it?
Right. Women really should be checking their breasts monthly. Self-breast exams are very important. It's especially important to be familiar with your own breast tissue and how things feel. So that way, if you do go to the doctor and your doctor feels something, you're then able to feel it as well and replicate that for us when you come for a visit. But often they recommend that you check yourself monthly. It's routinely noted that a good time to check is when you're in the shower, because you can use soap and move your fingers in a circular motion around the breast, and just feel for anything that feels different than the rest of the breast tissue.
What advice would you give to women, this month, especially being October? We've talked about how to give the proper exam, the myths behind having a mammogram and the discomfort and things you can do to kind of alleviate that. But, is there any other advice you would give?
I guess I invite any woman that's hesitant or scared or has had a bad experience to reach out to me personally, as I really truly feel that yearly mammograms save lives, and that we can make the visit comfortable and not scary, is it's really important to do.
Do you think that the information, stuff like this, has gotten out enough where it has helped? That women are now taking the warnings. They're hearing stories. Maybe they have other family members who have been affected by this, and they're starting to listen, and they're starting to do what they have to do.
Yes, I do believe that the word is getting out there. The majority of women, I think, are on board, but I do still hear stories every day about patients that are hesitant or scared or don't have a family history, so they don't feel like they'll get breast cancer, or they have small breasts, so they won't get breast cancer, or I have large breasts, so I won't get breast cancer. Anyone can get breast cancer. And so it's really important to get checked yearly.
You brought something up about family history, the importance of knowing family history. Like you said, you don't need to have it, family history, to have breast cancer, but having a family history, knowing that certainly will help, right?
Right, yes. And often having a family history will put someone at a higher risk of developing breast cancer themselves.
Oh, okay. So somebody is listening to this or watching this, they want to reach out. You said they reach you directly, but what's the best way if somebody wants to come see you, come see the department, make an appointment here at Gifford?
They can call the department directly. Most of all of my breast cancer patients, and even some of just my routine breast patients, even have my personal home number. But my office number here is 802-728-2231. And I truly mean it when I say that if a patient has a question or a concern or is scared and just wants to talk about mammograms in general in the process, I'm more than happy to be available.
All right, Jennifer Hubert, breast care patient navigator at Gifford. Thanks for joining us. Hopefully you continue to be busy this month and you get to hand out a lot of goodie bags.
I hope so.